there's going to be plenty of animals being dissected for everyone to get a chance. So by all means, it's interactive. Don't. Anyway, I'll hand over to Michelle. Feel free to stand up. Don't be shy. Gather around. Madeira is going to set the camera up down here and record.
Pulls up for now.
And I can explain all the different anatomy between the different species. There is gloves and there's a couple of pairs of instruments, so you can all have turns if you want. I'll start with one animal. I forgot to bring scalpel plates, but I have there's different sizes. You've got small and medium gloves, so you can all put some on to touch them if you like to, but join in and just ask me questions. They're flicking their tongue when it happens, so I see heaps of tongue injuries in them. And they often have skull injuries too, but once I see that, that's enough to put them to sleep. This is one of Tom's animals that was fine when he got it, and then what happened, Tom? This has got heaps of substrate in there. Sometimes you see things. And then I'll kind of start just on the edge here. Once you get under the skin, it's pretty easy to cut down. So when we do surgery on these guys, we don't cut in the middle where that line is because there's a vein that runs along the middle. So we always go to the side. And I'm starting to dissect reptiles more than I used to, which is pretty cool. They do a lot in the States. And it's all going to smell a bit, so it's pretty normal. So ask me questions if you want to know.
Do you find that lizards are harder to cut than snakes?
No, not really.
Not really? You don't find the skin tougher on either of them?
Skin's tougher on some lizards than others, like a shingleback, and these guys a bit on this part. But other than that, not so much. Once you use a scalpel and scissors, usually it's not so bad. The black coloration is normal. So another reason why I do these for you guys is that for some of you, when you have an animal that passes away, you could do this yourself at home to try and find out what's wrong. And you only can know what's wrong if you know what's right or what's normal. So by knowing the normal anatomy, and there's lots of stuff you can find online these days where you can look at anatomy of reptiles and you can look yourself. So, you know, sometimes you might microbiology. So most of them have similar anatomy to us, but it's just all changed a little bit. So this structure here, there's the trachea, so the windpipe that goes down to the lungs. Everything's all, wasn't freshly dead, so things break down a bit, which is quite normal. So these are the lungs. We've got two on these guys. And usually if it's freshly dead, they'll be a bright pink colour. And usually a light pink. If they're a dark reddish colour, then that usually means there's some sort of disease present. And then the heart is here in the middle, and it has a sac around it, called the pericardial sac. This can come closer. That's heart there. Yeah.
It's kind of further down the body than you would expect.
Oh yeah, way further.
Yeah.
So like with most mammals, the heart is usually around about where the sort of legs are, or the middle of the chest. But reptiles, it's always further down. Well, not all of them actually. Some of them's up there. They're all different. It's hard to do. Like snakes, you can feel where their heart is. You can feel it beat. I don't know if many of you felt that on your own snakes. But if you feel them really carefully and they relax, you can feel their heartbeat. And you can actually take blood straight from their heart. It's kind of hard with these guys. And then this is the liver, which should be the normal liver colour. This one's not. It's all decomposed. This is the stomach. It goes to the small intestine. This was a female, and that's her ovaries there with the follicles. And this stuff here is fat. So most reptiles that are healthy have a really big storage of fat on each side.
Sorry, can I just...
Maybe. Can you hear me? Can you all hear me anyway?
Yeah.
And then kidneys, they're all, each species is a bit different. These are the kidneys here. That structure on that side and one on this side.
Is that like a reasonable amount of fat? Like,
Yes.
Are you happy with that?
Yeah, I'd be
amount of
happy with
fat?
that. Yeah. Could be a little bit more, but that's about average for a lean animal. Yeah. Cool. So play around. can do a snake. Do a snake? You want a snake?
Her name was Sylvia.
Sylvia. How long after she got bitten did she die?
I wasn't there.
Ah, okay.
So, do you know what sort of bite actually killed Sylvia?
I think he just strangled you. Both my black-head pairs.
Really?
Yeah.
Sometimes I have people, I had like I think a year or 2 years ago maybe, heaps of people with blue tongues were fighting, and I had heaps of injuries in blue tongues somewhere, which is weird.
She's 12,
Yeah.
and they've been together a lot. It's weird.
Wanted a divorce.
Yeah, they just wanted a divorce. But he's half the size of her.
Really?
So in terms of biting, like, stop constricting.
Well, it wasn't the bite, it was the constriction.
Right, so she can-
Yeah, like
Then he tried
she's
to eat
pretty
it.
pink looking, and they're not usually this colour.
So we found a pretty
Like
quickly.
heaps of bruising, yeah. So snakes have ribs all the way down.
Well,
Right.
it's like
Oh no, it's quite pink actually. It's usually paler than that. More like light chicken coloured.
it's good education. And I've never done this.
Oh yeah?
No,
Never chopped open your own snakes. I remember I did this when I was
I
about
always go to do it. But
10 years old, I think, to a red belly my dad killed. I'm like, oh, I wonder what they look like inside.
Isn't that how Jeffrey
Domestic
Dahmer
violence.
Lucky I went the other way, hey. All animals instead. We used to breed our own rabbits and stuff for food, so we used to chopping things up. Someone can help
So-
if you want. Harry, you should help.
The curved scissors. You always go the curved scissors, or just
This is
random?
what my nurse gave me today.
Okay.
I started my nurses too. I was pretty busy today. See, lots of fat. I'll go through. I have to open it up all the way so you can see it all.
Where the fat originates from the bottom and goes up like that in the lizard and it seems to do.
Yeah, lizards have fat pads on each side.
What's it called?
Fat pads on each side of lizards.
Fat pads.
Yeah. The snakes have it still down the bottom. See how it's in the bottom half of the body, the caudal part? Snakes is the same. They don't have it up the top here. See?
There's a line and
Yeah. Quite interesting. There's got some up here too. Snakes are wild big snakes. You usually don't have such big animals. It's cool because you can see the anatomy way better.
yeah.
So when I do surgery on snakes, I cut, not on the ventral scales, I cut a couple of scales up across here and then sort of move everything over to get into the abdomen.
So Michelle, when you're doing that, you're cutting the
So just
skin,
skin.
and you're able to open up the body cavity just
Yeah,
with your
there's
fingers?
yeah you can, it's really easy to rip.
Yeah.
And I usually, sometimes I cut it when I dissect them, if I'm doing surgery, sometimes I use scissors, but sometimes I just cut it, and often you don't have to stitch that back together, I stitch the muscle and the skin.
Yeah, so the
Because
muscle
they've-
just cleaves apart.
Yeah, it does. Yeah, see, if I cut along where I'd normally go, which is here, and then I just pull it across, and then I'll cut here,
Oh,
like this.
okay, yeah, so it's
Try it. I don't cut where the ribs are, and I cut just adjacent to the ribs, and then I'll stitch this layer here. Sometimes, depending how big it is, stitch this back to there, so stitch the muscle back together.
And then the skin after that.
Yep. And when you stitch their skin back together, we have to stitch it like this, a vertex. You can't just put it back together like this. It has to be touching like this for it to heal properly. They heal really well.
That's got ovaries in there.
They just, no, where? No, that's not ovaries. That's fat. She's a big old snake. Yeah, I know.
Yeah, I am actually. Just something I wouldn't do myself, but it did.
How much are you charging it tonight?
I sometimes do this for free for people, just because I'm interested too, especially if it's an animal I've been treating. I just want to know. So lots of reptile medicine is really frustrating. And these days it's been really lovely because more and more pet people are willing to spend a lot of money on their reptiles, so I can do more tests. But doesn't always mean that I get an answer.
Is that your fat down there?
Yeah, it's fat. So I'll start at the top. So start with the mouth. So the epiglottis, which is this hole here, and that's where their windpipe goes to. So trachea connects here and goes down. And the trachea in snakes are made up of solid cartilaginous rings. So ours and mammals aren't solid all the way around. They don't form a complete circle. They have a membrane on the bottom. But snakes have it continuous like a solid ring, so it stays as a solid ring when they eat something big, so they can still breathe. So there's the epiglottis, which is the start of their windpipe, trachea, and it lines up to the top here, which is the choana, and that's where the vomeronasal organ is, up in there, the roof of the mouth. I don't usually go into their brains, it's kind of hard to do without mushing it. It's not very big. And then, ouch. This is the esophagus down here. Okay. We've got jugular veins, which I don't usually utilise very much, but I know that you can do a procedure where you cut down to catheterise that. But there's vets now, and I've attempted a few times and without success, but there's a vet overseas that places a catheter into their tail vein now, which is kind of really cool, which means you can give fluids and drugs that way, all that under anaesthetic, which is really nice. And then keep going down. So the first thing we come to in snakes is the heart, which is here, and it's quite big, but and then we have one.
Where is it, Michelle?
Right here.
Why is
Big
it so
blue.
big?
Yeah, they got a sac. Pericardial sac.
Oh,
Is it such a distance to pump all the blood, or why is it
It's
so
just everything's elongated along in a snake. But that's pretty standard size.
big? Okay.
You see heart disease in snakes sometimes, and you'll have a big swelling there or a tumour, but not very commonly. And there's not much treatment for it because most of the drugs are made for mammals, and so we don't really know if they work very well in snakes. And then this is the lung. It starts here. So they've got one true lung, and then they have an air sac that runs the rest of the way. So this looks pretty healthy, except bruised. Yeah, you can see how it's got like little sacs in it, and then that continues down about 3/4 the length of the body as the air sac. And you know when they hiss or breathe in and their whole body swells up, that's because they're taking air into this air sac. That's just like a thin sac that goes like 3/4 of the way down. Yeah, and they have a residual lung on the right hand side. The main one on the left. I think I always mix up which one. Yeah,
So the
this.
lungs aren't equal on both sides?
No. Where's Glenn? You remember?
Got one big one.
Which side is it the left hand side that has the main lung and the right hand side is a residual one on a snake? I always forget. Is it right other way? It looks like left on this snake. Yeah, I know. It looks like left on this side. Yeah, I know. I thought it was right too, but then the snake is on its left. So on the other side, it's like yeah, it's left. On the other side, there's barely a lung there. So they only have one side. Things in snakes have been elongated and stretched out and simplified. So, and then this structure here that starts about here, that goes all the way to here, is the liver. So they have a really big, long liver. So the liver in mammals and in these guys have different lobes. See how there's different parts to it? In mammals we have like left and right sides and then have multiple lobes and a middle lobe. But snakes have one big long one. And then this is all fat. People always think that that's the ovaries, but it's not. It's fat. And then we have the esophagus goes all the way here, and then we have the stomach about here. And the stomach's empty at the moment. And if you open it up, you can see.
Halfway, is it?
Yeah. Well, that's when you feed them, it swells up, and that's the stomach. It has those lines in it. See, there's a bit of stuff in the stomach there. And if we look in these guys, wild ones, sometimes they got parasites in there. Just kind of, and then
Sorry, what was like that? That's fat right there because it's slim.
a little bit of fat. Yeah, but this
Yeah?
is fat.
And then so what's that up there?
This is fat.
That there.
It's either fat or they could be lymph nodes. They have lymph nodes all through the body, just like we do. I don't know the lymph node anatomy.
Yeah.
Yeah, I can't remember that. It's not really something I need to know.
With captive reptiles, they have a tendency to be sensitive. So is this
I wouldn't say
good one,
no.
or-
This is fine. This is what is pretty commonly seen, and sometimes you tell by the other side of them, like whether they bulge out and become completely
So
round.
this would be like a well-fed
Yeah.
wild one.
Yeah.
Yeah.
And when I see wild ones, they have fat like this in them too.
Yeah.
So,
We've got doggy bags if anyone wants to take me.
trying to find. So you have gastrointestinal system, which is stomach, and then it goes to intestines. And when it's in the intestines, the structure inside changes, so you can tell. So instead of having those lines, it has like a more like fluffy look to it. See? It's got like a different shape. Yeah, different structure. And then there's something here. So then there's a structure here, where's the gallbladder. And then they have three things together. They have a gallbladder, a pancreas, and a spleen in a little combined structure. So the pancreas and spleen are kind of together and the gallbladder's there. And it's separate to the liver. Whereas most other animals, the gallbladder is like right near where the, there it is, right where the liver is. But in these guys, it's far away from the liver, just because everything's stretched out. And then these are the ovaries here. Hard because the fat's in the way. See? So I've actually dissected a couple of snakes now, which is kind of really hard to do female snakes. But they're being egg bound, and instead of having to separate it, you can keep them with the male, and you have to dissect all this away. But I have a cool instrument that sort of ligates and cuts it, so it makes it quite, but it ends up with a big incision in the snake. It's kind of tricky.
Are the ovaries?
Yeah.
Are the ovaries
Hard to
always?
do.
Are the ovaries always in that membrane?
In the what?
Membrane there.
Yeah, they're kind of within, like there's like layers that cover everything. So you can see here. See?
Yeah.
So they're like that.
Okay.
They recover pretty well though. The ones I've done it recover pretty well. And then,
She had one notch, so they just roll out.
yeah, the ones I've done is like second time. And I'm like, if I'm doing opening it up, I might as well just take it all out. Yeah. And these are kidneys. One here and one on this side. And sometimes there's an adrenal gland that's really obvious to see, and sometimes they're hard to see. Yeah. I've seen kidney tumours in them. I've seen all sorts of tumours in them. I've removed the kidney in one snake. That went pretty well too. Amazingly.
What are the most common things you perform surgery for on snakes?
On snakes, egg bound's pretty common. That's like during that time of season. Sometimes tumours, got quite a bit of mace things. Yeah, not many. Sometimes lacerations in like wild snakes, and we stitch them up. But that's about it really. Most of it's just all medical things there to do it. In lizards, it's a mixture of stuff. Sometimes tumours, taking some pretty big tumours off lizards. Sometimes trauma. Sometimes they start losing digits and things, and so you're amputating feet or legs. Dissects a bunch of lizards. You can dissect turtles too. My friend's done overseas, but I haven't done one yet. You're just going through the pocket on the side.
You do this one?
Huh? First girl or boy? Let's go.
What's
Huh? Is it?
So this would be your first turtle, would it?
I've done surgery on them this way. So I've cut a hole in there to get a fish hook out. I was able to get the fish hook that route that way and stitch up the stomach and stitch everything up, and it went really well. Yeah. Is it boy? Okay. Because it's a long tail. These aren't like the long necks. So. These are hard to dissect. I need it. I've done it before with a scalpel blade and cut through here. And you can try with a pair of scissors, but you'd be, yeah, I usually use a saw. But I didn't bring one today. You just can try.
Sorry, just out of interest, like,
Yeah.
see the fat deposits in
Mm-hmm.
the snake, right? The snake's obviously, when it hatches, it has fat deposits.
Yeah, it has some.
Has some. So,
I've
are
only got
these,
much as a baby. I haven't really dissected many babies.
but all of these little things, like, these look like they've just stacked on stack. I didn't realise they all separated. Like, I've seen the fat deposit as like that before. But is that Does that mean that all of those were like a very, very small fat deposit
Yes,
when it hatched?
and then it gets
and
bigger.
then it got bigger? So
Yeah,
it's not like
yeah.
it just stacks on these
No,
little things.
you don't grow more fat cells or more fat sections, whatever these are called.
So if it was hatched with 100 of these,
Yeah, I'd
it's
say
still got 100 of them.
I'd assume so.
And
That's
then,
what
and then
would be
how
my
come
idea.
that's all like looks like little separate things, whereas that looks like another?
It's kind of like separate things here. It's just all stuck together.
Okay, yeah, fair enough.
But these ones might be different. They look a bit different in bearded dragons. I'll come around on that side. Anyone else can join in if you want to. Come closer. Scared. Scared.
DOA. Dead by
The fat pad in these guys is really different. It's like one solid fat pad. And I have a couple of lizards this year pass away because they got, I'm assumingly secondary to being obese, is my assumption. Because they got fed heaps and heaps of silkworms and put on like a couple 100 grams, which is for one of these, is like heaps of weight. And they kind of just got other illnesses, which I think were all related to being fat. Which is really sad because they were very good pets and that's why they got overfed. So these are follicles.
This green one over here, the gallbladder.
Yeah, it's really big too. That's big. And the liver, it shouldn't be that colour, but it could just be a post-mortem change. It's really hard when they've been dead for a bit.
It's been in the freezer for a while.
And they get, I think these other ones have fat deposits here, and then you fatty liver disease that cause that.
It's not skinny people.
Yeah, fat here as well. I had one that had I did surgery on one because it had a foreign body. It ate they put the whole packet of crickets in and it ate like a chunk of cricket. And it lived for about a year and then passed away. These balls? They're follicles.
Red ones.
Yeah, follicles. They're not usually that colour. They're usually this colour. It's all been dead.
Is the red
That's the heart.
like are they
What? No, they're usually like this colour. They're not usually red like that. But it could be, if they were red that colour, I'd say it had reproductive disease. Yeah.
What would cause that?
They just get reproductive disease if they're not bred. So most animals are designed to like breed every so often, every cycle or every season. And when they don't, and the follicles stay there and regress and get big and regress and get big, sometimes things go wrong. And it happens really common. So it happens in like dogs and cats too. If you have a dog that's not dissected, she comes on heat over and over and over, she's more prone to getting like an infection in the uterus and they can die from that. That's why we say to dissex animals. So in America they dissex these really commonly now to prevent that from happening. Dissex a lot of rats and rabbits get reproductive disease really common. So do birds, but birds are really difficult to dissex. So we give them an implant that shuts down the hormones.
Would you be able to cut open a bit of the neck of the face there just to see
Yeah.
the fat under there?
Yeah, 100%.
What sort of body score would you give this one from what you can see?
Yeah, it's like fat there. And I think that's within the structure. I had one that was like this fat here was like really big. So that bit there. And it was like, I thought she might have had a tumour. So I CT'd her too. And then this was the same colour as this fat. I'm like, more fat in this poor lizard.
So what would you body score this one?
I'd say she's healthy. That's a good body score. Yeah. 3 out of 5. Yeah, that's a normal size. It's kind of annoying. It gets in your way when you do surgery. Hurts in the way. But it's normal. You want to turn? Go for it. Okay. Do this one or that one? You want to do the same? Yeah, of course. You just start on one end and slide the scissors down. If you cut something by accident, it doesn't matter.
So I cut from this side.
You can, yep. And then go through the skin. Do this one too.
The ribs are still like really flexible.
Yeah, hips flexible. You can cut them really easy. So if I do surgery and I cut too high up, I just go through them.
And then like so on a live
I don't
animal.
mean to. I wouldn't normally do that.
But on a live animal, and then
cut
and
them
that
easy.
would grow back, or that'd be
I
okay.
won't go back, but bend up.
And that'd be
Stitch
fine.
it.
Yeah.
Yeah, it won't stop moving. It goes more.
Would that like let's say during mid surgery that happened, would that seal back up?
If I stitch, it wouldn't by itself, but I would stitch it and I'd go between the other ribs to stitch
Yeah.
it
Okay.
to keep it strong.
I'll cut it.
I'll start. Yeah, no. Trying to get used to
love to see this.
Then
I once found a skeleton.
This is all your fast.
But it had been crushed. And I couldn't quite make out what it was. It's just like chaotic something.
it's hard. Big snakes are hard to.
Where's all of this now?
Bad at that. When they're red like this, it usually means that there's an infection, but it can also be postmortem.
How far you can actually. If you watch how far they do it, I'm just wondering how far you can actually.
Yeah, I can get in. Just feel like this little check.
Tend to play around that stuff.
See, I'm not the only one.
Just gotta hold them a certain way.
Exactly.
It's one of the big ones already.
I'm just wondering how far you can actually. One of these horses on the deck.
Huh?
Running these horses.
This is that little sharp, so there's ways that you can use them, so it makes them a bit easier.
You see the inner jaw then? The 2 sets.
Pretty cool how it all separates.
It'll still be recovering.
No, their ovaries were really red, so maybe reproductive disease, but nothing. And their liver's really pale, and their gallbladder was big.
So that's your ribs, right?
Yeah, that's the ribs there. So that's the membrane, like the bottom membrane there. That's the ribs where you want to go.
And what's this one?
That's lung or air sac, and that's liver.
Oh, got you.
Just your that far down, so the heart will be about here somewhere. Make it easy.
Exactly. That one's still struggling.
I'm used to using scissors that aren't sharp, so that you waste your breath to use them, and it makes it look better.
Just gives you a appreciation for it. It's like inside and
Normally, how do you do with the turtle? If you want to
Get a saw.
yeah.
You can do it, but you can just break it.
Ah,
But these ones are harder than long necks because the bridge is so much bigger.
yeah.
I don't know. That's what identifying these.
But there's no way you cut from the side into it.
Yeah, so you know you cut all the way along the edge here. So you cut from here,
Yep.
along there, and around the top, and then peel it open.
All right.
It'd be cool if we can get into it. Oh, no, so surgery, you go in through here, or you cut a hole,
Oh, really?
take it off, and then put it back on.
Oh, wow. You know what, glue it.
No, wire it. You can't use glue on shells because the glue goes in the gaps between the bone, and then that causes the what's the name? The bone not to sit back together because this is bone, right? This is modified bone and this is bone, and the spine runs through the center of this. And the bones attached to the shell, top and bottom, they branch to one side that allows them to move.
I've heard of resin being used to glue shells back together.
You shouldn't glue shells. The glue goes between the two layers of the shell, so it prevents it from growing because the shell is live.
It's from growing.
Yeah, it's not from healing. The shell is live, it's bone. You can't glue bone together. So if you glue a structure on each side, the function that holds it together, like
Use it the wrong way.
you know, like a U shape like this, then that would work, but you don't glue the actual structure. I can try it again. It's going to
like dental concrete.
No, you have to. The shell's bone, and the shell is live. But if you get it,
Nice shirt.
Africa, buddy.
Yeah, here you go.
yeah, very exciting for you. Different things. You can use other hooks with runnings. You can use like saddle.
Oh yeah, you're right.
And that works pretty good too. But sometimes the arrow light comes off. So I was going to do a study on them because we have the CT now. So we've been CTing them to look at how much fractures they have.
Is that a roadkill?
I don't know. I have no idea. I don't know who they belong to.
It was roadkill.
That one was roadkill?
Because I can.
That's quite heartbreaking. Sounds like dead special.
Yeah. It's a fairly like whole roadkill.
Yeah.
Normally they get squashed up.
Bit of plastic and screw it to each side that keeps it in that position.
Get him to dissect through there to show you the
Yeah, I was going to ask.
How
I
many?
was actually going to
Yeah,
ask.
exactly. That's a big male, right? It should be a big male.
Like you can see, I was trying to get the top teeth out.
See how the teeth goes.
You're going to do the whole thing and then look at it.
Got to press the gum up. You press up?
Yeah, but it doesn't, like, on the bottom, it moves really easily.
Yeah.
But on the top, I don't want to touch it with my finger, you know, because I don't want to get stabbed. But you can feel them.
Yeah, no, it's weird how the
They're there.
Protected by the gum. No, don't just.
They lock.
Yeah.
Oh, these are forceps, they're not scissors.
Yeah.
Is the monitor?
Yeah.
Can you show us how sexing like the heavy pinks?
Oh, you'd have to cut it. Oh, look how much blood's in there.
Yeah, no.
I was just trying to say, like, the bottom teeth obviously come down out when you push the down, but the top teeth don't.
Yeah, they do. Look. See?
Yeah. Also, I pushed down on the jaw here.
Is it broken?
No. I just pushed down, and there was like a pustule sort of a thing,
No,
like
they have little glands and
this thing. It just like seeped out a bunch of clear
Oh, yeah. It might have been an injury.
something.
Oh, it could be saliva.
Yeah, that. I
salivary
mean, there's
gland.
lots of it before, but
Yeah.
that there.
It's probably the salivary gland.
Yeah. Okay.
It opens up around there somewhere. Yeah, it does on this side too. Look.
Yeah.
Notice when I squeeze under here? That would be
Yeah.
the salivary gland for sure. I don't know.
They
It
said they
doesn't
have
feel like
venom
it's
gland,
fractured
right?
anywhere.
Yeah, well, they should have some sort of.
Yeah,
Hey,
100%.
that's a good thing. Could you show us where the venom gland is?
I don't have any. There's no venomous things.
Yeah, they are.
Huh?
They
No.
are.
Oh, these ones. But that would be it.
All monitors are venomous.
Yeah, but that would be in the salivary gland. So it's not a venom gland is the salivary gland.
Sure.
The same thing. I don't know where they are exactly. I've never really dissected them out. Someone
Yeah.
asked me once to take it out of their snake, and I said no.
Yeah, fair enough.
But it'll be around here. Around here
It's
somewhere.
always on the
I'd have to
bottom
look.
jaw.
Yeah. I think snakes is up here.
Yeah, that's
From
right.
memory.
Yeah.
Around here somewhere. I don't know. That's just a modified salivary gland, really.
Yeah, Nick
I don't know the anatomy of it myself.
Nick Youngman did the study on monitors.
Yeah, they have venom. So do beauties.
Also what?
There's
Beauties?
a bit of venom in them. Have you ever been bitten by one that breaks the skin? It hurts for ages. And they did a study ages ago, and they got a mild venom too.
Yeah, okay.
That's pretty new.
But they hardly ever bite and break, like, you know. No, if you cut open here, you might find it. You have to skin the head. When they finish with the scissors, I'll have a look around.
Someone said it might be a male because it's the size of it.
We'll be able to tell when you open it up because you'll see testicles, ovaries.
Yeah, well, for the size and the hair shape, it looks like a male.
Or is this a?
No, it's a wild one.
Do I have a claw?
Huh?
Do I have a claw?
Technically, no, but I don't see you take it. Yes. So it's stomatitis. So RI is respiratory infection in the lungs. Stomatitis is an infection in the mouth, which is what they call it canker. Oh yeah. Canker. So canker stomatitis. So this one is sick. Has stomatitis inside its mouth. Yeah, did you see it? Yeah, you can scrape it all out, you can put topical things in and give them antibiotics, and I've seen them come good. But sometimes the infection goes into the actual jaw, so they get osteomyelitis, and it takes ages to treat. Ages and ages. Yeah.
this one was seized, so we didn't have any money to
And then they grow
do anything.
Get a glove and
What do you
turn
do
the
with them,
glove
right?
inside out.
This one? Wild ones. You're not supposed to take them because it's national parks. Did I say if I cut it like this?
I'll probably do the bones on this one.
My partner was like,
This one I want to
one day when the world ends, and we have to pass something weird spell to save it.
Oh, there's a toe.
Dragon tail.
You're going to make a key ring out of it.
I'll try.
Have you tried it?
Thank you.
Yeah, from what I've seen in the literature, but the size of them is like,
So tiny, right?
and it's only if they're like freshly gone.
Because we said if stuff came out here, it would ducks, but like,
Yeah, it's really good.
that's it. That would be it there.
So try to skin the feet.
Yeah.
And this one has blood coming out of its ears, so it had head trauma too. So, not a happy.
We've got one Lacey that
Yeah, they can. Yeah.
gone,
Tongue gone, and it's still
just
aching.
about, but it's still
Like
on.
with the fork gone, like that.
It was down here.
Down here, it's
Down
still
here.
ate. I had someone that had a snake with no tongue and it still ate, but most don't.
Yeah, I've got a snake that was born without a tongue as well.
And it eats?
Albino Darwin. Yeah, that's perfect.
Yeah, some do, some don't. But I've had them before where I've tried to save them and then they haven't gone well.
It feels really unnatural, like I'm fighting.
Tearing.
I'm almost fighting myself.
They're so tough, right?
No, I just mean like mentally.
Yeah.
Mentally, I'm fighting myself, trying to cut it.
Yeah.
I'm not going to ask her. She's going to hit me if I do.
That's my, she's the same generation as my boss, like, well, the one I bought the clinic of, so same sort of, yeah. She's nice, lovely person, right?
She's amazing.
Yeah.
And like she stitched it up the tongue. She stitched up the tongue.
Yeah, you can stitch tongues up.
Redid it twice.
Yeah. They get recurrent ROIs for two reasons. One is because stuff gets stuck in their lungs and they can't
随便录那个特写。
bring stuff up. Like, and I think the other reason is that they have viruses in which they don't. You know, with secondary infections, they get over it.
Every now and then, it's like a whiff, eh?
Virus takes hold.
Yeah.
It's like it goes from being no smell to like a smell.
That's the stomach. Yeah. It's drawn up to here. That was in the esophagus.
You reckon we?
But I can't open it here.
You reckon we open up the?
Can I have that for a sec? Can I have that for a sec?
It is, yeah.
It's just their favourite thing.
The lungs have a bit of mucus and stuff, so snakes can't get rid of that.
It's a shame.
They've got little hairs that bring everything up to the surface, but I can't cough that out. I can't get stuck. This is like stuff, so it's swallowing the pus from its mouth and it's lodged in its, this is its esophagus. Yeah. And they get stuck.
It should be a big male, right?
No, it's going down. It's getting worse and worse. Are you trying to find hemiplenes?
Yeah.
You can sex it that way.
That's a having pin, right?
He wants to play with it.
That's a having pin, right?
Probably.
Yeah.
I don't have an X-ray.
That should be it. Yeah.
No, you don't know. It's supposed to be next
No, that's from Chris. So that's a Hamilton. Got a Hamilton. Fun one. Oh, that's still going. How long is it?
Is it actually a hemiplane?
No, where is it?
It's a muscle, right? you gotta like.
Yeah. You push it out. There you go. There you go. That's a big male. So it goes outside like that.
So it has a muscle that retracts it.
Yeah. Oh, that's cool. That's cool. So they push it out. Push it out like that. Like that.
This one's liver's like a bit paler than the other two. That's when they get sick. See how this one has less fat? It's not unhealthy, it has less fat.
Suddenly it's all about penis. Like, no, guys, how old are
On chest, you can see a high white cell count. This one you can see the adrenal gland. Unless that's that might be. Yeah, this is the adrenal gland. This is the testicle. That one's a male. That's the testicle. That's the adrenal gland. You can see it in this one. So the adrenal gland's probably bigger in this animal because it's sick. Yeah, so the adrenal gland's pushing out more cortisol because it's stressed, it's sick. I'm going to help you get out. Have you got it?
Got it. There you go.
So this one died, it was euthanized, but it would have died.
Let's stand on this side. There you go. Cool. Got the
Yeah,
hand.
you need to do that one and see if it's a female, but cut up the middle.
Oh yeah, that's right.
To see different,
That's a female one?
different way to sex.
Just be careful with this one because it's heart attacks and
No, you don't.
yes. It's a nice one.
It's like a balloon already.
I'll just do it here.
It's pretty cool.
Cool.
You're gonna do it.
Look how beautiful.
I don't know if you really want to do that one. Probably may not. Pretty lovely. It's like starting to decompose.
Yeah, I'll
Yeah, you go for it. Sorry.
Success!
You can put that one in a bag if you want.
That's why I brought some bags.
Sorry.
They should have been able to slow down.
We don't talk about that.
I don't know how many turns I've seen here when I'm slowing down and trying to move it and the next person hits it.
They hit it in a 40s and
He's hit them all huge. It's a rock.
exactly. It's a massive thing in a 40s and roadway.
How do you, if like an
That's pretty fat.
They can have it back, but
That's pretty fat.
I know, I use a support. There's two on each, the bridge on each side and open up. Oh, awesome. Yeah. I teach myself everything. I do stitch them if they want them back, and I open them up like this.